So in this video, we're going to look at how to use the MiHealth symptomatically. Now, in the previous video, we were basically looking at the ERs. Now, the ERs are most suitable for unblocking any energy blockages, getting the body's energy to flow properly, and that really is conducive to getting the body field to work properly. When the body field works properly, cells are able to communicate, information and energy flows properly, and that really gives you the ideal environment or conditions for the body to heal. However, that said, sometimes you just end up in pain, and if someone has a particular spot that is really, really painful and they want to get relief now, then that's also completely viable that you just want to go and treat their pain right now. Now, I happen to, well, I've also had a number of climbing injuries over the years, and in particular, I've just been aggravating this wrist. So Cyril's going to show us how to reduce some of the pain in my wrist.
Certainly. So first thing, you'd obviously have a look at it and speak to the client. How long has it been going on for, Harry?
Well, in this particular case, about 2 weeks, but it's from a long-term chronic problem.
Okay, so there's both chronic and acute components of it. You've probably got inflammation here, and you've been agitating it in a variety of ways.
Well, I'm unfortunate enough to have snapped a tendon in there, so it does get aggravated repetitively.
Okay, well, we've got quite a few choices then. Within the physical folder, which I'd consider this a physical starting point, I might start with physical rejuvenation, which is a broad treatment that'll give us a little idea what's happening inside. So I've just chosen that on the device. I'm just drawing it around the area. Straight away we're getting sensations that are telling us maybe a starting point of problems, the asymmetry. The device is grabbing in that area. You've probably got a heightened sensitivity there. You can feel it a little more.
Okay, yeah.
And I'll just draw through the area that you were focused on. Now it's clear here. Here we're finding something. And it almost feels like braille. I feel the little sensations of the device vibrating. So we've just opened that up. And
what setting did you have that in?
I started with physical rejuvenation. Now I've used that to open it up. That's the first on the physical folder. But now I'm actually going to do something else. Now I've opened it up, I'm going to use the next one down, which is chronic. Okay, so that's chronic physical. There you go. And now you can hear it sounds slightly different, but it's also changing the type of information patterns that are going in. So we're, should we say, sharing the patterns with the body. There we go.
Yeah, and chronic and acute balance, they're basically for pain. So chronic balance is really for chronic pain. Acute balance is really for acute pain. And if you don't really know what to do and someone's in pain, you literally just use the chronic or the acute setting, and chronic if it's been there for a long, long time, acute if it's a recent injury. And there are a lot of other options like nerve and rejuvenation and these other types of functions, but really for the purposes of getting to know the MiHealth and just getting it to be really effective, you can actually just go straight to using it on the chronic and acute setting. And in some other videos, we'll basically go through some of the functions in the other folder, or Cyril might actually do it alone tomorrow because I can't be with him tomorrow.
Now we've just provided 3 different settings to you: physical, chronic and acute. Now just give us a little motion, tell us what's happening, and tell us where the extension is. Okay, that's it.
No, that's better. It's a little bit constricted
right
there.
So now there's a more pronounced sense of it. Okay, cool. Now we talk about using the device in a symptomatic way, Harry, but let's say you're a dancer, let's say you're a ballerina. I
was a dancer, but I wasn't a ballerina.
Well, my son's a ballerina, and he uses the device to limber up before going into a training session. So in some ways, you can plan how to use the device to give you better flexibility and avoid injury, not just wait for injury to occur. So in a symptomatic treatment, if you had, let's say, difficult hamstrings, you might treat them before going into your training session, so you get a better exercise, less injury, and much better progress in your chosen sport or place of interest. There you go. Now test it out.
Yeah, it feels much better.
There we go. And that's just a couple of minutes of treatment, rapidly bringing the body's focus to those areas.
Easy.
Excellent.
Well, that was great, Cyril. So now we know how to do a symptomatic point of pain treatment.
Keep it easy, keep it simple, make yourself comfortable, make the client comfortable, and your watch changes rapidly occur.